Hi, Wellness Warriors. Today we have Dr. Ryan Wohlfert, and we're going to talk about chronic pain, what you can do about it. I know a lot about people out there suffering. I have friends and family very close to me, and I see the toll that this takes on people. And so we're going to give you some tools and make this something that you can do something about. So welcome to the show. He is a certified chiropractic sports physician and a certified chiropractic biophysics physician using a specific protocol for spinal and postural correction to break free from chronic pain and disease and organ dysfunction. So welcome to the show.
Thanks for having me. We're going to get probably maybe even too deep into the woods on the spine and how that all relates to your overall health too. But yeah, I think your listeners are going to love that. I love the wellness warriors. Geez, that's great.
Well, we do have a very nerdy, educated, information hungry crew. So I don't think you're going to bore them with your details on the spine, especially if we can translate it into actionable steps, which I know that we can. So before we get into your personal story, I like to ask two quick questions, just so people kind of get your flavor, so to speak, like understand you personally. And the first is really easy. It's just, what do you have for breakfast? And if you didn't eat breakfast today, which is what almost everyone I interview says, what would be a typical breakfast if you were to eat one?
I guess if you're talking food, breakfast, a smoothie,
Yeah.
typically I'll have one at like 10 or 11 o'clock, somewhere around there is my first meal.
Mhm.
I go through cycles and stages and phases of like what I have to drink, I guess, for breakfast. Like right now, I might have some green juice, like
Mm.
from Farmer's Juice, or even like a good low sugar, less than 10 grams, 8 to 10 grams of natural sugars in the juice.
Yeah.
So I'll have that, or like a greens powder. I consider that my breakfast, but tons of water. I have a lot of water, distilled water for my breakfast to go along with my supplements. For if I was going to have a meal of food for breakfast, it would be eggs. It would be like some Applegate sausages,
Mm.
something like that. Some nice grass-fed type of beef, type of sausage. So that's the main things that I would have.
Awesome. And I'm imagining that there's some sort of benefit to chronic pain of windows of fasting. Is that true?
Oh, heck yeah. Because, it's not just, I say our minds get distracted, or our minds get not even distracted, but inundated with all this stuff. And if we inundate our body with food right off the bat, it's not giving it a chance to basically to clear out even the toxins that are in our body, if we just keep putting it in there. And then also, if we just keep eating and eating and eating, and we can put in on like weight, that doesn't help with our pain either.
Yeah.
That increases I should say, decreases our ability for our body to handle I want to say stressors that we put on it. If we're not getting the right fuel, and if we're getting too much fuel in our body by eating too much and too soon, especially getting up from sleep. When you not too often do I get up starving, and
Yeah.
right. And if you get up where you're starving, then you definitely need to take a look at, all right, why is your body not functioning to where you're laying down and not moving for 7, 8, 9 hours, and you're starving because of that. Now, maybe you didn't eat, you fasted starting at 6 p.m. and now it's like 8 a.m. I could understand that, but even then, but yes, through chronic pain, because chronic pain, it's a more general term, like an umbrella term, right? Which includes headaches, migraines, back pain, neck pain, post-surgical pain. People have surgery to
Yeah.
heal or think they're going to fix their pain from that, of whatever is causing it. They think that's what's causing it. I got to cut it away or get cut on. And we think that's going to fix it. And yet they're still left a lot of times in the same position, or maybe even worse down the road, still taking the same medications, maybe even more with that. So if we can teach our body how to heal and give it the right information, whether that's, mentally, physically, chemically through the use of food, then it's going to give our body much better raw materials, if you will, to actually heal the body. But we have to make sure we're strategic with it somewhat. We don't want to overthink it, but we also have to eat clean, whole foods. And if we don't, I always like to say, don't complain about the results you didn't get by the work that you didn't do.
Oh, yes. Very nice. Okay. I love that. I love that vitalistic kind of view of the body, that we don't need an outside authority telling us what to do. The body is very smart. When we give it what it needs and take away what it doesn't, like, beautiful things can happen. And just, I think that coming from that place, that knowledge changes the way you do just about everything. So thank you for sharing that. That was beautiful. And the second question is, what is the craziest thing you've ever done in the name of your health?
In the name of my health, oh boy.
Yeah.
See, it's weird because I just don't even think about it, anything as crazy. I really don't. I will, man,
It's a hard one.
crazy thing is probably, and this is maybe opposite, in 2008, I tore my ACL playing basketball, and people said, well, it's because you're getting older or too old. I'm like, no, it was because I was playing and I jumped really high and I came down on somebody, they bumped me. So that's what I always say to that. But this just popped into my head to where, like, that night I tried to gut through not taking anything,
Mm.
like for my knee, and I couldn't sleep because it was just swollen up. I was trying to keep the sweat, like put a neoprene brace around it, and I didn't take anything. And this goes to show you, yes, I am for traditional medicine when it's needed, but in the name of health, I'm like, I don't want to take anything. I don't want to take even Tylenol. I don't want to take any. And even after I had the surgery, once I had the surgery, I didn't want to, I like the Vicodin or the opioids that they were given. I stopped those immediately as quickly as I could and tried to just control the pain with ice. So I I guess that would be a crazy thing to most people. Is like, I'm trying to avoid it as much as possible just because I don't want to depend on anything or get hooked or addicted onto anything like that.
No, you sound like me. I know exactly how that is. So, just as a follow-up before we get your story, like, what other than ice, was there anything that you added that you thought was very helpful for reducing that pain?
At the time, I was, not a whole lot. No,
Okay.
I
So
just, I did
just
my
ice.
physical therapy exercises. I started those really fast. Nutrition, I really wasn't big into like whole food nutrition back then, even in
Mm,
the mid 2000s, just because I hadn't learned as much about it. Because I could always, this could go into my story too, to where it
yeah.
was always hard for me, being an athlete, to gain weight. And so I was always trying to gain weight. So I was eating everything I could. And I grew up in a German Catholic family in the country. And we didn't have a McDonald's. We didn't have anything within 20 minutes of us. So we
Mm,
had nice home cooked meals. We had a meat and potatoes and some type of vegetable every meal for the most part.
awesome.
My mom made it, we all ate together. So, I was in a good position there, but you know, I didn't do anything else that I can remember back then. Like, I didn't know about essential oils. I just basically, honestly, I worked on my spine. I worked on my physical health, and that's what I remember from back then. Because it wasn't until, like, I would say around 2013, 12 areas where I got a lot more involved with how my nutrition was affecting my body and how it was leading to pain symptoms that I was having.
Awesome. Well, thank you for sharing that. I know Dr. Mindy Pelz came on and she said that sometimes after injuries, she would fast for a day or two. So I just didn't know if that we worked in what you'd done that, but you weren't there yet. So, okay,
No.
well, tell us, yeah. So your story. So you grew up an athlete and with this amazing mom, it sounds like, in this amazing setting. So
Yeah.
what led you to be so passionate about chronic pain?
Well, I mean, it started when I was in the eighth grade. Honestly, I was 13 years old, and I was sitting in my social studies class, and I was trying to read and I couldn't see the words. there's like this spot in the way, like if you look at the sun or a light, and it was just like a spot, and it just wouldn't go away. 10 minutes after that, my arm and my hand started getting tingly and numb.
Mm.
And then even went down into my leg.
Mm.
10 minutes after I had those, now I was switching classes, and my teacher asked me a question, and I remember I couldn't answer her. By that, I mean, I couldn't speak. I could think, but the words just wouldn't come out. So about a half hour after that first symptom started, the blind spots, the aura, which I know what it's called now, the numbness, tingling, and then finally the disillusionment. That's what in confusion. That's when I got my first migraine headache. And I've had headaches before then. I just didn't know what this was. It was like, hit me like a ton of bricks. I mean, every position I moved in, it was like throbbing pain. So again, I didn't know what it was at the time. All I did is I went home, like I called my mom from the school office. I went home and just slept. And I think, again, I was 13 years old. I'm pretty sure my mom, or, I took some Tylenol or ibuprofen or something like that. So then again, it went away after a couple of days. I was still able to go to school the next day, still able to play basketball that night in our first basketball game, because, I had to do it. I wanted it, that's my love. So then a week later, same thing happened. I started getting the spots, and I knew what was going to happen. So I went down to the school office and asked the school secretary, Mrs. Arntz. It's actually the mom of one of my best friends. And I said, I'm about ready to get a headache, like a horrible headache. Do you have any Tylenol? And what she said actually changed the course of my life and how I treat chronic pain myself. Again, looking back, it's always easy to see that 2020, where it's like, this is where it kind of, started. Even in addition to the fitness that I was into in the sports. But she said, you know what? I can't give you that stuff. I can't dispense drugs or any medications, even if it's over the counter stuff. Said, what it sounds like you got a pinched nerve. You should go see my chiropractor. And
smart lady.
Right. And I didn't know, again, I was in the 8th grade. I didn't have a driver's license. I wasn't, I was dependent on my parents. So, but what is I think even more amazing is she didn't stop at telling me. So she called my mom to come and get me. And then she told my mom when she got there. And so then my mom took me to the chiropractor. And, Mrs. Arntz called the doctor and said, hey, somebody's coming out there, take care of them. And so I got my exam, got my x-rays, and I still remember what the chiropractor told me that first time. But when he was showing me the x-rays, after he took them on me, he's like, look right there at your spine, at your neck, especially. He goes, your head's on crooked. And I still remember that. Yeah, it was, because it was like he showed me what was going on and how that was causing interference in my body's ability to get blood flow fully, to get the nerve flow into my head and throughout my body. And so he gave me an adjustment, and it was like fireworks went off. And that was the first experience I had with that. He said, feel your face, and just, circulation returning to my face fully. And so ever since then, I've been going to a chiropractor, for different reasons. But now when I get adjusted, I say it's for health. It's not for any certain malady or disease, just that reframe of the mindset. Because, for chronic pain, when you're in chronic pain, you think it's never going to go away. You think it's never going to get better. And if you're a day where you don't have it, you think, oh my God, finally. And then maybe it comes back.
Yeah.
Or not, maybe it does come back. And then you're like, great, this is never going to go away.
Yeah.
And the more we try to treat the pain rather than helping your health improve, sometimes that keeps it there. And that's one of the secrets to dealing with chronic pain is not just saying, okay, it hurts here. I'm just going to look here at trying to find a solution for my low back pain or my shoulder pain or my knee pain or my headaches. It's okay, how can we make the body function at its highest level and get rid of these interferences to our body's ability to heal? And that's, that's why the spine is just intimately related to our overall health, including, pain and inflammation that we can get.
Yeah, I love that you shared that. I have a lot of friends who have migraines, and for some of them, chiropractic has been amazing. And for others, it's been a piece of the puzzle. And then they've had to dial in a few other lifestyle factors. So before we get into those ways that how do we create this resilience and health and balance in the body, can you first tell us, just define how people would know chronic pain is an issue for them? I'd imagine like they do know, but like, what are some of the disorders and what are some of the things that they're doing traditionally in a conventional model that might actually be working against them?
I love that you said that. People in chronic pain, they tend to know, oh, that's me, right?
Yeah.
But yeah, we need that. So in general, chronic pain is you have to have this pain for at least 3 months, but it's usually people have it longer than that. And it could be anywhere from, just annoying and agitating and irritating, but that's the lower level. But in essence, what it does is it limits your activities. It limits whether all the time or some of the time where you're like, I can't, go to this wedding. I can't, get down on the floor with my kids or my grandkids because it's too painful. It's hard for me to get up. It restricts your activities. So physically it does that, but then also mentally it leads to like anxiety and depression because of how we talked a few minutes ago about you just feel like it's never going to go away.
Yeah.
And the things that people try and are still the most common, which is disheartening to somewhat, and I'm happy that you allowed me to come on here to share this, is over-the-counter medications, just like I did with Tylenol or ibuprofen, which actually that, it almost inhibits, not almost, it does, when we take those chronically, inhibits the regenerative process and actually wears down the joints and the ligaments and the discs too much. It wears them down. It hurts it makes it harder to repair because it stops the inflammatory response that we actually need. We don't want it out of control, but we also need that initial inflammation. And what I've almost replaced inflammation with and swelling with sometimes is circulation. We want to keep the blood circulating to bring the good stuff in and the bad stuff out. And that's one of the things that fasting does, is helps to take the bad stuff out, to clean out the cells, the dead cells, or the cells that aren't functioning. Yeah. Now, how would somebody know? Like I mentioned a few already, where migraines is a big one. Again, that was mine. And we'll get into this too about these other lifestyle measures, because fitness was a piece of my puzzle. Chiropractic was a piece of my puzzle, and spinal health, I should say, is a piece of the puzzle. Nutrition became a huge part over the last 10 years. So all these things, and it's not, okay, start with this one, and then, there's the foundation. I like thinking about it like a wheel. They're all connected. We need them all to have that optimal health and not have the chronic pain. So sciatica, leg pain, shoulder pain, any type of pain that you feel is limiting your activities. I talked about post-surgical pain, fibromyalgia. That's probably one of the most common ones as far as what people equate with chronic pain. Chronic fatigue could even be considered a pain, if you will, just because of the debilitating nature that can have. And I remember one of a patient, I definitely resonated with him. His name is Craig, and he had chronic pain, shoulder pain for 20 some years. And he had MRIs, had physical therapy, had other types of therapies, and he just could never get over that hump. And not only did that pain limit him, but by the end of the day, because of just that pain that he was feeling, he liked to be active. He liked to be outside doing yard work. And he was my age, and he's my age, a couple years older than me. And he said, how do you say it? He's like, by 5 o'clock, he's just wiped out. He doesn't feel like doing anything. So after we started on this health regimen with him, through spinal health, through exercises, through restoring his postural health, and we'll talk about why that helped. He was outside, and it's like your brain changes. It forgets sometimes where it was. And he was like, he wheelbarrowed a bunch of rocks, doing some landscaping, and all of a sudden he started on something else, and he realized, holy cow, 3-4 months ago, I wouldn't have been able to do this. And he just did it without even thinking about it. So those are the types of things that I just, love. And it's all about, again, one of the interferences that he had was nobody really addressed his spinal posture, spine and posture, because, your posture, it's a window to the spine and nervous system. So anywhere that it's distorted and off puts stress and irritation on the nerves, on the spinal cord, on your body, and prevents it from, I should say it uses too many resources to help you fight against that poor posture.
Yeah. No, I love that. Okay. Yeah. So I wanted to get into that. Thank you for sharing that. So it sounds like no matter what kind of pain you're suffering from, there's something that can be done about it. And there are reasons that it is happening in your body. And so let's talk about those causes. You just said the spine. So the spine is a big one, right? And if it's out of alignment, your body is constantly stressed, trying to kind of compensate and allocate its resources to, overcoming that imbalance. So you can start there. You can talk about the influence of the brain, but just talk about the most common causes of pain that you see.
Now, and that's a great question. I appreciate, I love your summaries of that. That's beautiful. And, I like to equate it to 3 things, if you will, or the stressors that we put on our body, not just the stress as far as mental stress, but that's one of the 3. So physical stress, like injuries, right? That we've had, sports injuries. I know you're familiar with that. I'm familiar with that. We've had our injuries, and that's the most common one that people think of, that, okay, if I feel pain, I must have done something physically to cause that, right? At least that's in my experience from working with, thousands of patients and over 20 some years, is they always think it's some type of physical thing. A lot of times it is, whether it's a chronic poor posture, whether it's an acute injury, those can happen. Well, you can also have more like chemical type stressors. So the foods that we eat, the toxins that we're exposed to, these interfere, again, I keep coming back to that word, that interferes with our body's ability to heal. So our brain interprets, that as a stress. Food is a stress. So what it does, it tries to get your attention through pain, gives you the response of pain. So pain in and of itself is not a horrible thing. It's simply your body's alarm system, or the most common way that your brain tries to get your attention. There's other ways too, but in general, we'll stick to that one. And then the third thing is like mental / emotional stressors. So what your brain, it's so amazing, because yes, physical, I think we can wrap our head around. That makes sense of how that can cause pain. Yeah. Here's the kind of a cruel joke, is if you have a physical injury somewhere, that doesn't mean you're going to have pain there. You might have pain somewhere else from you compensating, your brain trying to deal with that.
Yeah.
But, chemical, same thing. If we think at an extreme case, if you like put acid on yourself, it's probably going to hurt, right? Some sort of chemical. And now we're ingesting these things that do it to our insides and our cells on the inside, because we're made up of trillions of cells. So then the mental part of it is this: because your brain is constantly on tune to see, okay, what is causing stress, or what are the threats that are in my environment, both outside environment and internal environment. So the thoughts that we have, our mental and our mindset, if our brain perceives that as a threat or a stress, it's going to react in the same way as maybe you've had a physical stress on your body or a chemical stress into or onto your body. Your brain interprets it the same thing because it perceives it as a threat. So it might give you a pain response, a pain output because of that mental stress. And just think about, a good example is when you are mentally stressed, where do you feel it? So many people say that they feel it up in their upper traps. They get tight there. They might get a stomach ache. So those are physical pain manifestations of a mental or emotional type threat or stress.
Oh, yes, I definitely want to dig into that. I want to take all three and just kind of break them down for a second. But wasn't there a study too, I'm remembering, where when you take over-the-counter painkillers, it does something emotionally? Isn't it an emotionally numbing experience too? I feel like there was a study just kind of to speak to the interconnectedness of all of it. And so let's start with this postural, like, obviously,
Yes.
seeing a chiropractor, identifying your specific unique imbalances is really a critical piece of the puzzle. Is there any way, I always see those ads for like the thing you put on the back to remind you to stand up straight. Are there steps we can take just in our daily lives, either to identify that this for sure is a problem for us, and also to kind of overcome it for just like someone in the general population, or really does it require a visit to your chiropractor?
Well, there's always levels. It depends on what your goals are. Now, not all chiropractic is the same, not all spinal health is the same. And you mentioned, some of your friends had great success with chiropractors, and some of them it's more of the piece of the puzzle. And I think it's always a piece of the puzzle.
Yeah.
But when I started off, it was the traditional chiropractic where adjustments, maybe some different types of stretches and exercises. And now what I've learned over the last 10 years, it's this chiropractic biophysics. And that's what you said in the intro. It's CBP for short. And what that does, it combines specific postural exercises, adjustments, and different forms of traction. Now, what you mentioned there, like with those different braces that you see here, keep the shoulders back, you could probably consider that a form of traction. If you're trying to do this stuff on your own and you want to see, okay, would you be a candidate for different types of exercises as far as postural exercises? A simple way to do it is either one, look in a full-length mirror, and or two, get your phone out, set it up so it can take a picture of you from the front and then from the side, like a side view. So from the front, we want you lined up. You want your feet hip width apart, shoulder width apart, standing up, and you want these points lined up. Okay, if we were going to drop a straight line down from the ceiling or a plumb line straight down from the ceiling, we want the middle of your nose. Okay, basically your glabella, like right between your eyebrows. You want the breastbone, like the top of the sternum. You want the pubic bone on your pelvis, and then you want right between, equally bisecting where your feet are. That should all line up. Now, I can get in a bunch of these different positions, like, so you see here how, here's my sternum, and now my head is shifted this way. And you would think, how would anybody walk around like that? You'd be surprised. It's compensations a lot of times. You might have got injured and started leaning that way, and then all of a sudden your brain's like, okay, I'm going to keep it there. It might get stuck there. From the side, when you look at yourself, you want your ear, sorry, I'm turning to the side here, your ear lined up with your AC joint. All right.
Shoulder. Yeah.
In your shoulder, your acromioclavicular joint, middle of the shoulder, your hip, it's called the greater trochanter. If you put your fingers right on the bottom, like on your hip bone there's a bone on each side. It's called the greater trochanter. And then the outside of your ankle. Those are the 4 spots that you want lined up. Now, I'll stick with this one because, typically that one's not lined up on a lot of people or on most people, because cell phones, computers, our daily lives take us in this position of hunched over.
Yeah.
So let me come back to this. I want to point out, like, why is this such a detriment to your health? Why is this such a problem with chronic pain? Well, Rene Callier, who's a very well-known MD, and he wrote dozens of books on musculoskeletal health. And I love this one from him. This quote that he had is, to live a long, active, energetic life, few things matter more than good posture.
Mm.
And then there's another thing from the American Journal of Preventive Medicine. They showed that posture affects and moderates every physiologic function, from breathing to hormone production, spinal pain, headache, mood, blood pressure, pulse, and lung capacity are all among the functions most easily influenced by your posture.
Mm.
And I think, okay, why? It makes perfect sense. Because if we're in a position like this, sorry, I got to make sure I stay in front of the
Hunched over is what he's
when
doing.
we're hunched over, shoulders forward, head forward, what that's called is called a thoracic hyperkyphosis. So the mid back is called the thoracic spine, hyperkyphosis. We want akyphosis, we just don't want it hyper. We don't want it too much where it's over. Well, then, because that also leads to forward head posture where your head and neck is sticking out and you look like a turtle. All right. So just to give you that, and we've all seen people walking around like that where they're in that position. Where it starts is now to correct that, because also multiple studies have shown that this thoracic hyperkyphosis, and I'm going to scare people a little bit to help them understand why posture and spine is so important to our health and getting rid of chronic pain, is in this position. This is what they found in the elderly, is thoracic hyperkyphosis is a predictor for taking up to 15 years off of your life. And this is like adjusted for age, adjusted for gender.
Wow.
You know, that gives me the chills when I say that.
Yeah.
So now, okay, now that we talked about that and gave you like a picture of why it's so important, is so if you want to try this on your own and find out, okay, how is my posture? How is my spinal health? You could even like lay down flat on the floor. And if your shoulders aren't touching, or if, especially this, if you can't rest your head comfortably on the floor, that means you're already getting that hyperkyphosis. Okay.
Awesome.
And
Awesome.
so what can happen is you might need a little bit extra help to correct that through postural exercises, and then also some form of traction, because, you know, if the bones and the ligaments and the joints get fibrotic, if they, you know, if they get scar tissue around them from injuries, from uneven wear and tear, just like your tires can wear down if your car's out of alignment.
Yeah.
And just like your teeth, if they are out of alignment, if you need braces, or if you get braces on your teeth, pushing on your teeth once a week or once a month is not going to fix the structure of your teeth. Just like pushing on your spine is not, or doing one exercise a day for 1 minute is not going to correct that. That's where you need a little bit more. So if you're noticing like shortness of breath, chronic pain, headaches, and you've been to physical therapy before, hell, I love physical therapy. We're going to have physical therapy in our office. But this is the technique that we do to help correct the posture, correct the spinal position, because there's a normal for that, just like there's a normal for blood pressure, normal for hypertension, blood sugar, blood glucose. There's normals for all these things, our hormones. So this could be the missing piece for so many people.
Yeah, I love that you said that. And especially because one of my friends who suffered from migraines forever visited a really great chiropractor recently, and they found out it was a concussion that happened a long time ago that has been creating problems. And when they kind of adjusted, it was really miraculous and impactful for him. So, okay. So posture, I love that you laid it out so clearly. Lying on the floor, if your head stays up and you're having trouble lying comfortably, maybe we want to definitely make chiropractic a piece of the puzzle. Okay, let's move on to chemical. What are some of the most inflammatory exposures or chemicals that you see people like? Give us your top 3. What are people doing wrong?
Well, I mean, we're exposed to toxins, right? Mental, physical, chemical, but yes, the chemical. Glyphosate,
Yes.
Roundup, those, I would say that is the biggest offender, because that, oh my God, it kills your mitochondria, that kills it basically kills your energy. Well, now your energy, if it kills that and the cells aren't working there, well, now it's harder for our body to actually heal because it doesn't have the energy, the cellular energy to do so. And I'm not even talking about bouncing off the wall, energy drink, coffee, caffeine energy. I'm just talking about the cellular energy that our cells need in order for them to process the toxins out. So glyphosate, I would say, is number one. I would say another big one, I know in my case, was mold. That's like
Oh,
biotoxins.
yep.
That is a big one for people in chronic pain.
Yeah.
That they have these symptoms where it could be bloating, it could be more internal issues, maybe allergies or asthma or sinus issues, which I had when I was a kid too, even before I had the migraines, which were, I was sick all the time when I was a kid. My immune system was not functioning. So like mold and other biotoxins can interfere with your cells, with your body uptaking the key nutrients that it needs for it to, the nutrients and vitamins and minerals it needs for it to obviously function. So that would be like two there. And if you guys, I mean, I would say glyphosate, I would have organic as much as possible,
Yeah.
because that stuff is no joke. I want, that would be those two main ones. I'm going to keep it at those two.
Okay.
Biotoxins, mold, fungus, and don't be afraid of like fungus or candida, because it's a natural part of us. But if it's when it gets out of balance, that's when it can cause our body to go haywire, our brain go haywire. And now it wants to deal with that instead of dealing with other issues, and puts the resources into that. And that can lead to more chronic pain.
Yeah, no, thanks for saying that. And I don't know if this is true for everyone, but I noticed if I am eating a lot of sugar and I hit my hand, it hurts so much worse than when I'm not. And it is, I don't know if it's pronounced like that for other people you work with, but refined sugar seems to be just like poison to my system somehow in terms of like the way I respond to pain. Very
I'm
strange.
so happy that you said that, because that, I guess, would be my third one,
Yeah.
because I don't even think about that as a toxin, but it is. You're right. Refined sugar is one of those. It can make your body hypersensitive,
Yeah.
essentially. And that's why when that happens, you hit yourself, you hit your hand, and it hurts that much more because it creates more of that inflammation in
Yeah.
your body.
Yeah.
So thank
Okay.
you for that. So yes.
Yeah, awesome. Yeah, of course. So sugar, glyphosate, and mold. I love that you touch on that. Mold has been a really big issue for some people I love very much recently. So I know exactly what you're talking about. Last thing is, before we talk about your awesome offer, is what about that mental piece? Like you said, holding on to emotions, and we know emotions kind of sometimes get trapped in the body. So what's a way to know that is true for us? And also some steps that we can take to kind of unravel that or create a new relationship with our bodies.
Beautiful. So I, let me, I'm going to paraphrase a friend of mine, Dr. Todd Watts, and how he says, when somebody asks him, how do you know if you have parasites in your body? Right. And he gives them this test. I'm going to give you this test to know whether you are holding on to emotions, and whether you know if you are. So everybody, find your pulse, whether it's on your neck or on your wrist. So do you have a pulse?
Yeah.
Okay. You're holding on to emotions. Everybody does. Our body, that's what our body and brain does. That's what it's geared to do. If you have everything you've ever wanted in your life, you feel great, you have just, and not like a fake positive mindset, then maybe you don't. Maybe you're in the 0.01%. But all of us need to learn how to manage the emotions that we have, because we're living human beings. So we are experiencing emotions, and we're not taught, especially kids nowadays are not taught how to deal with these emotions that we're feeling. Unfortunately, they're given medications and drugs. They're giving, anti-anxiety medications, antidepressants at 10, 11, 12 years old. So how do we deal with these? And this is good for kids. This is good for for adults, how can we become aware of these emotions? One, just accept that we do have non-serving thoughts. We do have these non-serving emotions. They're not trying to hurt us. They're trying to protect us. But be aware of what they are trying to do and whether you need them or not at that moment in time. If you're getting chased by, down a dark alley and you're scared, okay, yes, we want that, we want that voice in our head say, get the heck out of here. But if you're sitting at your computer, and I was experiencing this today, just these emotions like, oh my God, am I going to get this stuff done? Just these deadlines. And am I going to get this masterclass? How is it going to be? What are people going to think? So these emotions and thoughts that we have, how do we manage them so they don't spiral out of control? The first step is just being aware of it and identifying what that is. What is that thought that you're having that's non-serving? I mentioned with chronic pain, if you're thinking this is never going to go away, it's never worked before, it's not going to work. That is a non-serving thought. It might be true and you perceive it as true, but have you had a day without it? Have you had, experiences without it? Again, for you, it might be hard, especially if you're in that pit where it's hard to get out of.
Yeah.
Right. Where you're just in that pit. So first, just identify what that thought is. And we call it learn your language, or what do you think about on a day-to-day basis? How are you feeling if you're not in chronic pain, but how are you feeling emotionally on a daily basis? How are you behaving on a daily basis? What are these things that are holding you back that you just can't stop thinking about or doing? So those, and if they're limiting you, if they're stopping you from living the life that you want and taking the steps necessary to get out of pain or to get out of depression or whatever your symptom or diagnosis is, then that's a non-serving behavior or thought. All right. So that's the first step, is just identify, become aware, learn your language around your story of pain. So now the next step is, first, one thing that helped me out huge in this journey was not trying to just think positive.
Yeah.
Not just trying to say affirmations till the cows come home. Not just like saying things that you don't believe in your unconscious mind that creates this cognitive dissonance where, just anyway, I'll leave it there. So instead, what I want you to do first is just interrupt that thought. Just identify it. I call it identify and interrupt it. In the moment, just say, okay, stop. What is your kill switch? What is the switch that you can say to, one, identify it, but then even two, interrupt that thought? So interrupting this non-serving thought before it becomes an intervention, right? You ever seen that show Intervention, where you're on drugs? You know what?
Yeah.
Let's interrupt this behavior before we have to do an intervention. So that's the first step. What is the kill switch? Again, for me, when I started off was, okay, stop. And there's a bunch of different ones, like, again, it's whatever resonates with you. I'm not a huge fan of this one, but it helped me. Is like, am I going to let this ruin my day? Because ruin your day. You don't want that in your head. That type of thing, just to pull you out of it. So now I want to give you something more on the, what you can do if I'm saying don't do affirmations, or if you can't, affirmations aren't the thing that I'm recommending. What I want you to do every single day, there are wins. There is evidence that you are moving towards the life that you want, out of pain, the goals that you want, whatever the goal is. It doesn't even have to be about health. It could be about your career. It could be about your relationships. And when you're in a physically painful position, it's hard to think about what's good with my health. Yeah. Maybe your relationship is really good, so let's do that one. But with any area of life, count your wins. The wins are not affirmations. The wins are evidence of the last 12 to 24 hours of something you did that led you towards your goals. And it's not necessarily gratitude either. Yeah. It's an actual thing, like, when your husband brings you coffee, right?
Yeah.
When you're between interviews and you're like, oh, he brings me coffee, that is amazing. You gratitude, grateful for that. But even if you had a workout today, boom, obviously that's a win. Let's say if you're in chronic pain, because I've known a lot of people like this where they just can't get out of bed. They don't want to get out of bed. Their life is stuck. They don't enjoy their life. Just getting out of bed and going to the bathroom maybe, or getting out of bed, going to the kitchen. That's a win. The more that we can stack those wins, the more it retrains your brain and rewires your brain to start thinking about those things and thinking about and perseverating on those. So then it retrains the brain to look at that and look at the wins rather than what it's trained to do, which is look at the negative. So identify and interrupt, and then also count your wins every day.
Beautifully stated. Thank you so much for that. And I have 3 customer or subscriber questions that I just have to cover really quickly. So, can you grow cartilage back in the spine?
Yes and no. I mean, it just depends on what is causing it. Depends on, there's different stem cell therapies now that we're actually going to introduce into our physical location, which is going to be cool, of regenerative medicine that's in the process. But then just like with anything else, if the stress is still there that caused it in the first place,
Yeah.
you might get rid of the pain, but the cartilage might not still be there.
Okay, awesome. Thank you. And what about shin and heel pain? Is there anything that shin splints and heel pain specifically?
Well, I mean, it depends on when you're having it, but how long have you had it, for one? And if it's a chronic pain situation, what we look at is one leg shorter than the other? Again, I go back to posture with that, because if you're walking, again, if you are in a position where, and we see this on a daily basis, where it's not just the slouch posture, but it's, your body is shifted side to side, one leg is shorter than the other, it creates a rotation in the pelvis. So then what happens? It creates a rotation in the legs too. So that's something that you want to look at, depending on what other things that they've tried.
Love it. Last one is someone who's suffered from chronic hip pain that's gotten worse. And she said, my CRP spiked after my second COVID vaccine last year. Do you think this could be related?
Yes.
Yes.
Because it increases the inflammation in your body.
Yeah.
It creates more interference with your body's ability to heal. So yes.
Okay, perfectly. Okay, so tell us about your masterclass. Obviously, this man is very passionate and you want to know more of what he knows. So where can we find you? How do we connect with you? And give us the spiel on the masterclass.
All right. So chronicpainmasterclass.com. It's a 3-day live event. So not only will you learn a lifestyle system of like how to treat your mind, how to treat your spine, and how to detoxify with nutrition and exercise. I handpicked 6 experts to show you how to do it. It's a literal do this. One thing that I don't say I don't like, I want to give you direction when you're done. Instead of like 30 people telling you to do their thing, this combines the science and application of how to fix chronic pain. And that's the kind of the nutshell version of it. But it's a 3-day live event. All of it's on chronicpainmasterclass.com. You can sign up for it. Again, with these people that I have doing this, it's amazing that I could do it for that. It's almost the average of a copay.
Okay. Awesome. Well, thank you, Dr. Wohlfert. And you've been wonderful. And everybody go check out the masterclass and send me your stories of how it helped you get out of pain. I'd love to hear them. So thank you for coming on the show, and I'll talk to you soon.